Health Minister Obadiah Moyo has been arrested for alleged fraud and corruption. Media reports coming out of the country say authorities are investigating a deal to supply material to the government for the management of the coronavirus pandemic at inflated prices. The country's Anti-Corruption Commission accuses Moyo of illegally awarding an inflated tender to Swiss company Drax International to procure PPEs and pharmaceutical drugs. Drax International is allegedly not even a pharmaceutical organization, but a consultancy firm which was only registered this year. Its contract has since been rescinded by the government. Now, the Zimbabwe Association of Doctors for Human Rights Secretary General Dr. Matara joins us now via Skype from the town of Chithoyi in Zimbabwe. Dr. Matara, very good evening to you. Thanks for joining us. Welcome to the Globe.
Thank you very much.
Do you want to share with us your reaction to the arrest of Minister Moyo?
Yes, of course, the minister is not new to controversy. When he was appointed Minister of Health and Childcare, there were queries and issues surrounding his qualifications, where he claimed to be a medical doctor, but he's not registered with the Medical and Dental Practitioners Council. There were also issues about how he dealt with the doctor strike last year, when doctors were on strike for almost 5 months, and he seemed to have no clue on how to solve that crisis. And now when it comes to this coronavirus crisis, which has been termed the COVID gate, it comes as no surprise when we hear that he has been involved in corruption issues, where he has been awarding tenders to shelf companies which have been inflating prices. You see prices for things like face masks, which are valued at less than $3, were being charged for more than $28 for one face mask. So it comes as things that is not a surprise to us. And of course, the minister has also been implicated. There is evidence that he actually wrote some letters compelling the permanent secretary to pay for some companies which were based in Namibia to provide testing kits for coronavirus. It also at inflated prices. So these corruption allegations are very serious, and we hope that due process of the law will take course, and the Zimbabwe Anti-Corruption Commission will be able to investigate this case further and come up with a verdict.
And we understand that the local representative of Drax International, Delisha Ngwaya, has also been arrested last week. Do we know from the ministry side as to, is the minister the only one who is arrested? Because surely he cannot be working alone.
Definitely, he cannot be working alone in these deals. We know that from the Minister of Finance, the permanent secretary from the Minister of Finance was responsible for signing all these deals, and he approved some of these deals, of which these companies have already been flagged by the intelligence that they cannot be companies that can provide tenders for the government, and but still they went on to receive tenders. So it's not only the Minister of Health, but also people from the Minister of Finance who authorized these deals and made the payments. They should also be involved, and they should also be investigated and arrested by the Zimbabwe Anti-Corruption Commission.
And Dr. Matara, I suppose then that this issue has now thrust into the spotlight the issue of the laxity or the strength of procurement processes in the government system. I mean, now that this is happening, who authorized the awarding of this contract to Drax International, knowing very well that it wasn't even a pharmaceutical company, but merely a consultancy firm?
Well, the tender process was not followed at all during this awarding of the tender to Drax International. It was simply minister giving instructions to the permanent secretary, giving instructions even to the Minister of Finance. There was no due process that was followed, and it's came as a shock to the citizens of Zimbabwe when journalists started revealing what was happening in the COVID-19 response. And what we can say is that no process was followed at all. The minister was just giving instructions, and no due process was followed during the procurement of COVID-19 test kits and equipment.
The country is in financial ruin as it is, and the fact that we're hearing such reports is not helping the situation in any way. And it'll obviously thrust into question the country's efforts of dealing with COVID-19. What is your analysis of how the country is tackling it at the moment?
Well, our response has been somewhat weakened by the fact that our health system was already at an all-time low when this pandemic hit this part of the world. You know, doctors were just coming out of a 5-month-old strike. Hospitals were working on emergency mode. Outpatients departments have already been closed. We have been witnessing a shortage of the basic things like emergency medicines, emergency equipment, and also health workers were being remunerated. You know, doctors are earning less than $200 at the moment, and the morale has already been low at the moment. So it's now come as a surprise to see that when we are facing basic shortages of drugs and equipment, and health workers were being paid very, very low wages, we see that the ministry have been awarding tenders of more than 60 million to shelf companies. That money could have been used to pay health workers, to procure equipment, to procure medicines, and that could have gone a long time into alleviating the problems that we are facing in the health sector. So the corruption that is happening in the health sector is taking its toll on in the health sector, and the citizens are suffering as a result of this corruption. And we think that the justice system should come to the bottom of this, and people who have been involved in corrupt activities should be brought to book, so that we regain our health sector and things become better in the health sector.
Well, by all means, we need to let the law take its course with regards to, seeking justice in this particular matter. And in the meantime, the procurement of PPEs has since been halted. And you, as doctors, are in the front line of the battle against coronavirus. So what should happen in the meantime while you're waiting for the government for the supply of these PPEs?
Well, as Zimbabwe Association of Doctors for Human Rights, we actually took the government to court, and the court granted us a court order to make sure that all health workers are provided with personal protective equipment. We have frontline health workers who were working without protection at all, and they were exposing themselves to this coronavirus. So we just hope that the government continue investing into healthcare workers issues, so that they provide the healthcare workers with personal protective equipment. And more importantly, I think they should also invest in healthcare workers so that they get remunerated fairly. Right now, we have healthcare workers down to, because they are saying what they are earning is not enough. Definitely is not enough. And we want the government to take this issue very seriously, because it's a very serious issue. They should make sure that those workers change, because what they're getting right now is stuff.
All right, we seem to be losing you there, Dr. Matara, but then thank you so much for your update on this matter. We truly appreciate your time.
All right, thank you very much.
All right, that was Dr. Norman Matara. He's the Secretary General of the Zimbabwe Association for Human Rights. Secretary General Dr. Norman Matara joining us via Skype.